Welcome back to the Nurse Scrub Club. Let's dive into part 2 of our hyperglycemia versus hypoglycemia quiz, focusing on reassessment and safe discharge. Question 1. A patient with hypoglycemia received 15 grams of fast-acting carbohydrates. 15 minutes later, the patient's blood glucose is 88 milligrams per deciliter. The shaking has stopped, and the patient is fully alert. What should the nurse do next? A. Administer insulin to prevent rebound hyperglycemia. B. Provide a snack or meal containing carbohydrates and protein if appropriate. C. Discharge the patient immediately without further monitoring. D. Give another 15 grams of fast-acting carbohydrates automatically. Think about your answer. You have 10 seconds. The correct answer is B. Provide a snack or meal containing carbohydrates and protein. Rationale: once the blood glucose has improved and the patient can safely swallow, a snack or meal containing longer-acting carbohydrates and protein can help maintain the glucose level and prevent another drop. Question 2. Which finding best demonstrates that treatment for hyperglycemia and dehydration is working? A. The patient reports increased thirst. B. The patient develops worsening confusion. C. The patient's blood pressure improves, breathing becomes easier, and glucose begins trending downward. D. The patient's glucose remains elevated and ketones become positive. 10 seconds on the clock. The correct answer is C. Improved blood pressure, easier breathing, reduced thirst, and a downward glucose trend indicate that the treatment plan is working. Worsening confusion or positive ketones may indicate serious complications like DKA. Question 3. Which statement by a family member shows correct understanding of emergency treatment? A. I should give juice even if the patient is unconscious. B. I should give more insulin when the patient becomes shaky. C. If the patient is awake and can swallow, I can give juice or glucose tablets. D. I should wait until the symptoms disappear before checking the blood sugar. Which one is it? You have 10 seconds. The answer is C. Fast-acting carbohydrates should only be given when the person is awake and able to swallow. Never place anything in the mouth of an unconscious patient due to aspiration risk. Question 4. Which patient is the best candidate for discharge after treatment for hyperglycemia? A. A patient with persistent vomiting and ketones. B. A patient with unstable vital signs. C. A patient whose symptoms improved after fluids, has no evidence of DKA, and has reliable follow-up. D. A patient who cannot monitor blood glucose at home. Take 10 seconds to decide. The correct answer is C. Safe discharge requires stable vital signs, improved symptoms, understanding of the treatment plan, and reliable follow-up. It's about more than just the glucose number. Question 5. Which finding most strongly indicates that a patient with abnormal blood glucose may require hospital admission? A. Glucose improves and mental status returns to baseline. B. The patient tolerates food. C. Symptoms improve after fluids. D. The patient has persistent confusion, ongoing vomiting, severe dehydration, or unstable vital signs. Last question. You have 10 seconds. The answer is D. Persistent neurologic changes, severe dehydration, or unstable vital signs suggest the patient is not safe for discharge and needs closer monitoring. Great job today. Don't forget to like, share, and subscribe for more clinical pearls. Bye for now.